All right, we are live on YouTube, and I'm going to let everybody in. All right, get started in just a couple of minutes. Good evening, everyone. If you're just joining, this is the Renters Alliance Renter Town Hall. Takes a couple of minutes to let people in the door. Welcome to everyone. Good evening, everyone. If you're just joining, this is the Renters Alliance Renter Town Hall. We'll get started in just a few minutes. Welcome. If you're just joining, we'll get started in just a few minutes. We'll give it one more minute and then we'll get started.
Matt, you want to set the chat so we can talk to everyone?
All right, let's begin. Good evening, everyone. My name is Matt Losack. I'm the co-founder and executive director of the Montgomery County Renters Alliance. With me is our staff, Tim Wong, Emily Towie, Melek Demir, and David Mullins, who also has two small children, so he'll be running back and forth between the screen and the kids. And we have two special guests with us tonight. We have Liz Kreuger, who's the Director of Homeless Services for Interfaith Works, and Dr. Anthony Young from Health and Human Services, who's the Program Manager for Services to End and Prevent Homelessness, if I've got that right. And they'll have an opportunity to give a little bit more of their bios when it's their turn. Let me just say a few things up front. First of all, if you have any questions or concerns, please put them in the chat. Our staff will be monitoring the questions and concerns, and we'll be answering them in real time, but we'll also get to a point in the agenda where we will also address questions and concerns. This is being recorded and it's on YouTube, so if you miss it or miss a part of it and want to watch it again, it will be available on YouTube. At the end of the discussion tonight, we will also have an opportunity for anyone to ask questions or raise concerns having to do with renters or your own individual situation. And we will, of course, allow you to, email us any old time if you have some other issue that is outside the scope of tonight's Renter Town Hall. We thought, as always, but particularly because it's December and it's getting colder, and the homeless situation in our region is still a challenge for many of our residents. The Renters Alliance, while we don't work directly with the homeless, we do work directly with many renters who are facing homelessness due to housing instability because of apartment homes becoming out of reach, for people who are unable to pay their rent anymore, and people who are just struggling for any number of challenges in keeping their homes stable. And it is a significant problem in Montgomery County, and it's a significant problem across the United States. I believe our experts will tell us, but I think the homeless situation has increased in significant ways in other cities and locations, and it is a terrible tragedy. The impact of homelessness is not only heart-wrenching in terms of its human impact on people, but it is also a public policy concern that has a lot to do with other financial impacts in terms of social services, in terms of families whose children who become homeless and their academic achievement is impacted, and of course the mental health and many other impacts that need to be considered, not just as a human tragedy, but also as a public policy issue. So we'll discuss a little bit of that tonight as well. So with that, it is my pleasure then to introduce our first guest, who again is the Director of Homeless Services for Interfaith Works, which I believe is the largest nonprofit in our region that deals with homelessness in Montgomery County. So it is my pleasure to introduce Liz Kreuger, if I pronounced that correctly. Liz?
Thank you, Matt. It's Liz Kruger, but it's an honest mistake. No problem at all. Good evening, everyone, and thank you so much for having me here tonight. This is a topic that I'm very passionate about. So I'm eager to talk more about persons experiencing homelessness and housing stabilization and a lot of the systemic issues that are endured here. So I'll start quickly just by sharing that I am a clinical social worker. I have been in at Interfaith Works since 2012. So this is 11 years now. So this is my experience is in persistent mental health and substance abuse disorders, which has been, there is absolutely a cross section for persons experiencing homelessness. But I have come into this role as Director of Homeless Services within the past year. So this is a new space, and I am it's a new space in leadership, but not a new population. So in this role, we were doing a lot more advocacy, which I would like to talk more about. But first, I think what I'll do is share more about all the services offered by Interfaith Works, and then we can talk about the Homeless Services Department. So Interfaith Works serves about 35,000 individuals in our community a year. So the services are quite expansive. We have an essential needs center where individuals can come for clothing at a clothing center. Individuals and families can be referred or called to make their own appointments. They can come to our food hub there as well. There is a marketplace where they can, again, set up appointments or have a case manager refer them for weekly service. And there is a connections team, which will actually not only provide direct services, which can include utility assistance and eviction prevention or rental assistance rather, but they will find services that may be helpful to individuals as they are identifying needs, and they will connect them as the program suggests. So they are the resource finders. They're almost navigators within our county system to assist individuals. We also have a vocational team, which takes referrals from all over the community, and they will support individuals looking to increase their income or to find work if they are out of work. So this is a robust and growing program. And then we have a faith communities team, which engages faith partners, not only in advocacy, but in direct services to the community. Now I've been brought here to talk about our homeless services, and this is our largest department. And we have 4 emergency shelters here in Montgomery County. So 2 of them are women's shelters. And by the way, our shelters are all for individuals experiencing homelessness, adult individuals. So there is another shelter, Stepping Stones, that serves families, but ours are for the individuals, which is the bulk of homelessness. So our 2 women's shelters are the Crabs Brand Shelter in Durwood, Maryland, and that serves 37 women. There is another women's center in Rockville at 2 Taft Court, also serves 37 women. We have a co-ed low barrier shelter in North Bethesda called the New Leaf, and that is 30 individuals, and it's 16 men and 14 women. And then probably one of our most well-known shelter spaces is at Progress Place, which is a county building, but we have an overflow shelter there as well as a year-round shelter. The year-round shelter serves 25 individuals. This is also co-ed. And then in the winter months, the numbers vacillate tremendously, but we're seeing numbers that are already very high. We've already had 77 people in our overflow shelter, which means that there were a total of 106 individuals experiencing homelessness in the building at that time. So for this time of year, that's extremely high. All our shelters have been at capacity. There's a capacity issue within our shelters. As I said, I've been in this space since 2012, and this is some of the worst we've seen. There is dramatic problems with both the inflow and outflow of the shelters. There is an increase of people coming into homelessness for the first time, but there's also problems getting people out into housing for a variety of reasons, which we can discuss as well. I will also mention we have 7 supportive housing programs, which are range from rapid rehousing, which is a time-limited subsidy, to permanent supportive housing, which is permanent housing with long-term supports. And we have both that out in the community as well as site-based programs that have more intensive 24-hour support. So we see the spectrum of homelessness from the time that people come into it, which, as I said, we are seeing a lot more people that are first-time homeless, and they are a lot of them resulting from the protections lifted from the pandemic, the evictions, as the moratorium was lifted, the evictions finally caught up, and we in 2023 have seen a huge impact on individuals and on families, as we do serve families in our housing side. So if it's okay, I am briefly going to share some slides that come from the point in time count this year, which is happens in January, at the end of January every year. It's a HUD administered survey in which we take a snapshot of what homelessness looks like in the county. And it includes numbers from all the shelters and families and individuals, as well as individuals sleeping out on the street. So volunteers and homeless services staff go out on the street, and they will interview individuals they find sleeping to identify their needs, and in fact confirm that they are homeless. And because it's one of the coldest times of the year, it's also indicated to be some of the most accurate readings, and that's why it's done at the end of January. So I'm going to share my screen. I think these are important numbers that reflect the increase in homelessness and the growing number that we're seeing. Okay, so on the point in time count this year was on January 25th, so almost a year ago, and we will do another one this upcoming January. But the overall number of persons experiencing homelessness demonstrated a 53% increase. So it went from 581 persons in 2022 to 892. This is significant for Montgomery County for our numbers. Also important to note is that families increased to 56 from 56 to 85, which is a 65% increase. And this is a trend that was consistent across the nation, that families in post-pandemic moratoriums being lifted were hit very hard by eviction. So what we saw with families in Montgomery County is reflective of what the rest of the country is seeing too. Some other important data around that is that 57% of individuals, so adults without children, so not families, were over 45 years old, 35% over 55, and 10% 65 years or older. So this is, again, a consistent trend that seniors are heavily impacted, increasingly so by systemic issues and the cost of living and affordable housing. Other important findings were that 30% reported having serious mental health. 10% reported substance use disorder, and 5% reported co-occurring disorders. So this is a 36% increase from the year before in mental health conditions and 68% increase in substance use disorders. As far as families, there was 15% that reported a serious mental illness within the household, which is an increase of 88% from 2022. So again, this matters a lot because we're seeing some of the impact of the pandemic and how this played out in our individuals and families. And when it comes to homelessness, this is often where all our other systems have failed. And I do believe that is how a person experiences homelessness. Finally, some of the physical health findings that were 21% of those counted reported a physical disability, which was a 43% increase from 2022, and 13% reported chronic health conditions. So and that was a 50% increase. So the medical conditions were also significantly increased. So this demonstrates to me that this is a disability justice issue as well. So when we talk about affordable housing, systemic failures, the cost of living in Montgomery County, all these safety nets that are available but are not enough, there's also an increased need for services and support to persons experiencing mental health conditions and other disabilities, and how we serve them and how we meet people where they're at before they hit crisis. We need to be thinking proactively about how we serve them. So we at Interfaith Works collaborate with multiple entities and other providers. We do certainly partner with SEF, Services to End and Prevent Homelessness. They are the primary contractor of our homeless services, or we are the primary contractor of homeless services to SEF. And so they are a great partner to us in helping us provide services within our shelters and housing programs. We have great partners in behavioral health, but we are always looking to build better healthcare relationships. There is a tremendous inflow from hospital discharges that come to the shelter spaces. And we are also looking to build better relationships in the eviction prevention realm. So that is certainly part of our advocacy, is how do we help prevent it from getting to this point? What kind of renters' rights need to be acknowledged? We do find a lot of people leave their homes before they have to. That's very common. They don't know that they can stay. And so they become homeless before it's absolutely necessary. And that is, to me, that's a real tragedy when it's so preventable. So, and we could provide the support. So that is definitely a space we're trying to enter. And we are always looking for additional supports from the community and individuals to volunteer in our shelters, to offer their services. I think something that doesn't get talked about enough is how social capital plays a role in all of this. We are, within all our communities tend to see social capital decline. There's less involvement in civic engagement, in clubs, there's less dinner parties, there's less picnics, and that may seem irrelevant, but it's not. That is the same, that is very much related to how we have increase in poverty, increase in homelessness, because there is not general peer support across our communities. And we need more peer support and more community members in our shelters, providing services, providing groups, providing the social capital. I think, of course, we're a nonprofit, so we always need more money, but I don't, and resources, but I want to illustrate that relationships are a critical resource too, and that we need those more than ever. And we welcome expertise. We just welcome support and camaraderie. Honestly, our clients need to feel valued, and they need just people to talk to sometimes. So these are our asks of the community, is that you, and even if you can't donate, that you engage and support with time. So I think with that,
Liz,
I'm
I've
willing
got
to
a
answer.
couple of quick questions.
Please.
'Cause you raised a bunch of really interesting points, and one of the things that occurs to me looking at this from the outside, and I don't mean to make this sound diminished in any way, because I know it's not. Back when we were talking about my checkered history, I did manage a homeless shelter ages ago. And so when I look at this, I'm looking at it's still less than 1,000 in Montgomery County who are in the system. And so people say, well, it's still a small amount. I tend to think, and maybe my staff can weigh in with their own experiences, but that this is the tip of the iceberg. That what we're seeing is that's what's captured in the data. That's what we know based on the beds. But in my experience with working with the homeless and working now with the renter community, is that there's a whole uncaptured data set of people who are sleeping on couches, people who have moved away, people who are living with family, people who are just outside of our social safety net system, people who die for reasons that are not captured. What is your opinion in terms of what the 1,000 or so represents?
So the just under 1,000, the 892 represents HUD's definition of homelessness. So you are absolutely right, and that this goes to my larger point of how we define need. So literally homeless, the person has to be living in a place that's uninhabitable by certain standards. So they have to be in a shelter, living in their car, on the street. And that is how it's defined. However, there are, I don't even know the numbers, and Anthony, when he speaks, Dr. Young may have a better idea of how many, just based on how many people come into housing stabilization services, but there are so many people that call us for assistance that are doing just that, staying with a friend or family. A lot of people staying in their friend's apartment that's an HOC voucher, and they're terrified that their friend is gonna lose housing because they're staying there. We know this to absolutely be true of youth. So youth homelessness is something we as a county, I think, are trying to understand. We know it's growing, and by youth, that's HUD defines that actually as 18 to 24. We know that to be a growing contingent within persons experiencing homelessness, but they don't stay within our services for very long. They don't come to shelters and stay long for a variety of reasons. And I think it's because we're not meeting their needs there. So they do tend to be couch surfing frequently amongst friends, amongst family. But you are right, Matt. That does not mean they're not experiencing homelessness on some level. And there are so many more people that are just housing insecure. They're always on the verge of losing their housing. And that kind of that impact, right, on just on the brain, right, the neuroscience of having to live like that every single day in survival mode, it's terrible. It's terrible, and there's impact on individuals and families who are living like that in this county every single day. So the 892 are those that have exhausted the couch surfing. They don't have family or individuals they can stay with anymore. So that they are the tip of the iceberg, but there are thousands more that would meet homelessness definitions by our common colloquial standards.
Yeah, we are seeing the forced migration of working and low-income families from our region due to being priced out of their homes, and we know a lot of them have. It's not like they can jump to some other apartment that's affordable. It's just not available. And if you have roots, children in the schools, family nearby, medical needs, whatever, moving is not an easy thing, and they become a real tragedy. Also, what happens to folks when they can't find a bed in your system? What's the next step? If the 892? Whatever, what happens to 893?
Keep in mind 892 includes those who are sleeping on the street. So there is a population within homelessness here in Montgomery County and really everywhere that chooses not to come into shelters, and there's a variety of valid reasons for that. I think there's a lot of misconceptions around why somebody would be in an encampment or be not come into the shelter space, but there are a lot of people that don't feel safe inside the shelters. But there are also those that can't get in, and they can't get in on any given night, and they find they may sleep at the crisis center for several days. They may go try and beg a friend for a few more days. They may sleep in a stairwell, parking garages. It's dire. It's dire. They have to resort to extreme measures a lot of the time until they can get into the shelter. And we're having a problem getting people out of the shelter because for other reasons, for housing discrimination, which has absolutely increased. That is not just anecdotal. It is harder to get people out with subsidies or vouchers than it ever was before.
What advice would you give to the public who are sympathetic with someone who's homeless, want to help someone who's homeless, say somebody on the street? What would you say to them that we can give to them now?
If the person, I mean, it is cold, and it's going to be a very cold winter. If the person is willing to come into shelter, they should bring them or help them get to the crisis center. The crisis center is the triage point for all the shelters. So they will assess, and in cases where there's diversion opportunities, they may try and divert them back to family or other resources, but someone sleeping on the street is likely not going to be able to be diverted anywhere. So they should go to the crisis center, where they will do everything they can to get them into a bed right away. And if they can't, they will try. And right now, by the way, we do have increased beds. Like we have Rainbow Shelter for Women, which is open, and so that can be an option. So it is usually possible that right now they could get in somewhere, particularly as a woman, and as families, certainly they would be served in some capacity.
What about the
if they
police?
will not come in right away, and that is another thing, the best thing they can do is build trust and try and engage the person regularly. That is another common situation in which an individual is sleeping on the street do not trust people. So that engagement matters a lot. If you know their name and you know something about them, that helps. That helps a lot.
I was going to say, sorry for interrupting. The police and fire, if somebody comes across somebody on the street who looks like they're in dire straits, I mean, they all are, but some obviously are more critical than others. Would you recommend that people call 911 or call the police or call for an ambulance? And if so, what happens then?
They can, if it's extreme conditions, yeah, they can call the police and express concern. And I should say this too, actually, this is important for everyone to know. In hypothermia weather, so 32 or below, the Progress Place, which I physically is where I am now, so this is in Silver Spring, will not turn you away. You can always come here, and the police often will bring them here. So depending on where the person is, the police can bring them to the crisis center. They can bring them to Progress Place. So it's the police can generally be helpful in those circumstances. If there's a mental health concern, they can also, the police, particularly CIT police can petition them to the hospital. So yeah, I think we have developed better partnerships with police where they know what to do in those circumstances.
Okay, can we put the crisis center contact information in the chat? If one of my staff knows where that is, that would be great. Or Liz, if you could do that so that we know where to direct people. There it is in the chat for people to see.
Yep.
Any questions or concerns for Liz Kruger from Interfaith Works?
Yeah, there was
I
a
didn't-
question.
I'm sorry.
No,
Go
you're
ahead, Emily.
there was a question in the chat from someone about if they're living with, I'm assuming they mean they're living with a family member and like renting from that family member, could they still receive assistance from Interfaith? If like
Yeah, if
basically their
they're-
family member's the landlord in that situation.
So if they are an individual who's not stably housed and they are living with a family member, yes, they can
Okay.
still receive services. Now, that they are not technically homeless
Right.
by HUD standards. However, there's an array of other services, including diversion funds that can be used to assist the family, to that individual. And we often have people that will come to us. They've been staying with a family member, but they can't do it anymore. And we will work with them. We will work with them. And if they can't be at that place anymore, we'll take them into shelter. Yeah, that's
Okay,
not an
great.
issue.
Thank you.
Pat, did you have a question for us?
Well, I may have missed it, but I was just wondering how dire the situation. I did hear you say that the homeless population has increased, but in terms of the availability of beds through the county, just how many how short are you in terms of housing people?
And so in terms of, you mean in terms of sheltering, like
Yes.
what are the numbers of how many people have to be turned away? That's I can tell you the bed count. So I can tell you that at Interfaith Works, we have 133 beds. So between our 4 shelters, and then there is the men's shelter, which has up to 200, and that's in Rockville, which is a newer facility, has up to 200 beds for men. So there's right there, that's 333 beds. And then in the winter months, Rainbow Shelter, and there's another, there's a family shelter. So there's, let's say there's around 360 beds in the winter months. And we are still turning people away some nights. I don't, to answer your question, Pat, I don't know the exact numbers. That's something potentially like the crisis center or the diversion team may have a better idea of how many people they don't make it into, shelter on any given night. But we know what's happening because we have to tell them no.
So that raises an important question. What are there's several pieces in this puzzle. We know that Interfaith Works runs Progress Place. What and the Rainbow Shelter and the other, who are the responsible agents for these various services?
So, so there's the 4 shelters I spoke of for Interfaith Works, but then the men's shelter at Nebel, that is Montgomery County Coalition for the Homeless. So that
Okay.
is the nonprofit operating them, and then Rainbow Place is the nonprofit operating Rainbow Shelter.
Okay, and is anybody else involved in providing homeless services besides those entities?
Yeah, providing homeless services, yes. But in terms of shelters, there's also Stepping Stones, like I said, which is the family shelter, but they have pretty limited space. And then there is a Dwelling Place is another one that I'm less familiar with, but they also serve individuals and families, and I believe that's just during winter months as well. So that there's additional support in winter months to get us through the hypothermia season.
Sure.
So the and the crisis center, this is why they're the triage point, because they will be able to identify where there's space and be able to connect people from there. But I can say that Progress Place has the most the capacity for hypothermia. So on those 32 or below nights, anyone can come to Progress Place without being turned away.
32 or below is quite a standard. It's pretty cold when it's
Isn't it
40.
though? Isn't it though?
Freezing.
I know. I know.
You know, even
know.
55 is pretty cold.
Yeah, yeah.
Good to know. Any other questions, staff?
Yeah, Liz, another question in the chat for you. For the gender specific shelters, how are transgender individuals accommodated?
However they identify and however they want to be. So that is something we are faced with periodically, and it is their level of comfort. They can be where they want to be, and
Okay.
we will make it work. Yep.
Thanks.
So is the crisis center the triage before they go into a shelter?
It is generally, but how that doesn't mean we don't. There's also kind of like a no wrong door policy where if someone shows up at Progress Place, we try and serve them directly. The problem is that someone wouldn't know if there's if they just showed up at the women's center. There's no telling whether there's capacity or not. So we would never encourage people to just show up at the shelters. It just for their own logistics of having to go there and then be turned away. It's better for them to go to the crisis center because they will have a window on the availability of each place.
I know we
So
put
how is that
sorry, go ahead.
how is that communicated to the homeless people? Is it through, man on the street reaching out, and then how do they get there? Is it the 311 where you call the police during that weather and they will escort you?
Really good question. So theoretically, the individuals who are staying on the street should be working with an outreach team. We have multiple outreach teams within Montgomery County that survey encampments. They get calls if someone, and this is important to know. So there's EveryMind and City of Gaithersburg both have outreach teams that you can contact. If you see somebody sleeping outside, they can assist and go and try and meet that person and triage them. Down County, we have Pathways and Bethesda Cares. So those are names that I'm sure that are familiar to some, and they can do the same down in their catchment area in Silver Spring and Bethesda and Tacoma Park. So they will assist them as soon as they're ready to get to shelter. And oftentimes they know the client so well, they'll just call us directly and we can arrange something.
I see that the crisis center is located in Rockville. So does everyone who needs to be triaged through the crisis center need to go to Rockville, or are there other ways to be triaged?
There are other ways to be triaged. So if it is often, we encourage it, and Seth encourages it because of the efficiency. There's a diversion team there that will always tries to divert individuals out of homelessness first and see if there are other options for them. And so we encourage crisis center, but if someone's coming directly from a hospital, the hospitals will frequently make referrals through healthcare for the homeless. And we will take referrals directly from discharge. Like I said, the police may reach out or bring somebody by if they've found somebody out in extreme temperatures. There are scenarios in which we will take someone directly. So I don't mean to make it seem so rigid. It's just that the crisis center is able to take someone through the whole process, knowing what's available at what shelter, and try diversion first, and provide the transportation when needed.
Does the crisis center work through a telephone? If you're in crisis or you know someone in crisis, can they call and do a telephone assessment and
They
referral?
could do a telephone assessment, yes, and they also have a mobile crisis team that, while very understaffed, like so many of us, can come to a person who identifies in crisis.
All right. Any other questions for Liz Kruger?
There's two questions in the chat. One is that if Interfaith only operates in Montgomery County, and where their office is located. I think you answered that one, but and the other question is where someone who is facing domestic violence or has children can go, and if Interfaith Works has information on that statistic.
Yeah, absolutely. So the crisis center is also we'll do triage for individuals and families in domestic abuse situations, trafficking situations. There is a domestic violence shelter for individuals and families. There's services available to them through House of Ruth, Betty Ann Cranky Center, the Family Justice Center, and we have recently started working with the Anchor Fund, which can provide temporary one-time, two-time assistance financially to individuals in these circumstances. So there are resources. And we end up serving particularly women who are victims of domestic violence in our women's shelters quite frequently, actually. But again, the crisis center is a triage point for that too.
Oh, that was my question. So even though that's a different population that with different services, but they can be triaged through the crisis center. So I love the term "no wrong door." So I'm trying to promote the primary door here, which would be the crisis center. And if obviously the Renters Alliance, if that is on your recommendation, something that we can offer to people that we're working with who may be facing these kinds of crises, we would recommend again that it go to the crisis center if that's what your suggestion is.
It is. Now, if somebody showed up at one of our shelters, we would not just give them the address of the crisis center and tell them to go there. We would do our best to support them, and if need be, we would provide the transportation ourselves. So it's not they will be served in some capacity if they show up at one of our locations. Absolutely.
Thank you. Any other questions for Liz?
Yes, excuse me. I was just wondering for these people, do you have programs or any other support, or could they be sent to programs that would help them in the future, teach, education or just emotional support?
Yeah. And that's where our vocation, we have our own vocational program that will work on life skills, life coaching, job training. And there are several other vocational programs outside of Interfaith Works that we collaborate with quite regularly. So that's Career Catchers, Doors for persons with disabilities. That we work with all of them. We work with a lot of behavioral health partners for the emotional support. That is critical. The trauma endured by individuals, both experiencing homelessness for the first time and chronically homeless, it is just more than any human being should ever have to endure. So we are very sensitive to that, and make sure our own staff are trauma informed in how we work with them. So it's a great question. because it becomes more than just housing, right? That they need. There's a lot more support, and we are committed to that as well. Absolutely.
In the parlance of what we would call wraparound services, I suppose. Last question for you, Liz, for now. There might be other questions, but does Interfaith Works know of or work with unique housing providers that provide unique housing for people who require special types of stability, special types of services, for example, group homes, specially constructed houses for people who may be disabled, or housing programs where people can live independently but also receive regular counseling because of chronic and, for in some cases, terminal mental illness that requires constant monitoring?
Yeah. So do we make is the question to whether we
Do you have that
would
in your, do
refer
you have
them
that
to those types
portfolio?
that housing?
Yeah. Do you have that portfolio? Do you have, are there organizations that you work with? I know off the top of my head, I don't know if they're still around Oxford House, for example, that provides housing for people suffering from substance abuse, and they provide a program. I'm not sure what their overall portfolio is, but that's the kind of service I'm thinking of.
Yeah, absolutely. So primarily we are housing individuals through our coordinated entry system through the county, so that they are going to county placements, set 7 of which we manage at Interfaith Works, but there's many others managed by other nonprofits. So some of those are site-based with 24-hour support, where mental health providers can come on site and visit them. Even medical support can come on site and visit these individuals. So people are assigned housing within our continuum based on their level of vulnerability and need. So for individuals who have those kind of needs, yes, that housing is available within our continuum, and absolutely we will look outside our continuum for programs that are behavioral health based. Cornerstone Montgomery has several homes that are the requirement is like Axis One mental health diagnoses, where the needs are persistent and pervasive, and they have a whole support on site that is available to them. And yes, there are sober houses, the Oxford House, Lawrence Court. We will always try, when appropriate, to look outside what our continuum offers. Our primary referral outside our continuum is Housing Unlimited. For anyone who wants to look them up as a resource, amazing. They provide housing to individuals who have behavioral health conditions. There are some criteria, like they have to have an income of $400, and they have to be engaged in mental health treatment. But yes, we have partners which we house frequently with all those needs. Yes.
As I say, I managed a homeless shelter long ago, and it is quite the challenge. And I really applaud you and all of your staff and everybody who works in these shelters and the volunteers who help out. You are doing incredible work with an incredible challenge, and I think we all are particularly grateful to Interfaith Works for what you all do and the resource that you are. I know there'll be more questions, but I want to get to our other panelist, Dr. Anthony Young, who in some ways is working with us to prevent people from becoming homeless in much of the county's Health and Human Services Department's services to end and prevent homelessness. So let's turn it over to Anthony Young. Anthony?
Well, good evening. Thank you for allowing me this opportunity to just join in and have this dialogue with everyone. A little background on myself. I'm originally from the state of Washington, a place called Tacoma, Washington. I came here after the Marine Corps to the Maryland area. Went to school, and I worked for approximately 30 years in the federal government. Short stint on Capitol Hill working in the U.S. Senate, and served as a briefer for the Senate Select Committee for Intelligence and House Permanent Select Committee for Intelligence, as well as serving in a bunch of different capacities for national security policy. After leaving the government, I had a desire to get back on the ground, and my first experience was working with the homeless. So this is a great conversation that we're having this evening. As a young person in high school, I experienced homelessness, so it was something that was near and dear to my heart. So after leaving the government, I worked at the grassroots level in Montgomery County, working with several providers, assisting in multiple areas, understanding the real issue of homelessness within the county. And so thank you, Liz, for all your work that you're doing and others that are here this evening. Currently, I serve in the Department of Health and Human Services, and the Department of Health and Human Services, our director is James Bridgers. And under that, our chief for services to end and prevent homelessness is Christine Holmes, as many of you know, as a former director at the Interfaith Works. And so we're happy to have Christine on, because I believe she brings another view into the entire situation where persons are at risk for the loss of housing and also becoming homeless. And so we're thankful for that. I want to just dive in and kind of give you guys a quick snapshot. One of the things I think is important is that we have to make sure we understand that even our county executive finds persons who are homeless and those who are at risk of losing housing a serious thing here in the county. And so one of the comments that the county executive, Mark Ehrlich, has put forth as he's trying to address this issue is that he has a three-pronged approach here in the county on affordable housing. Number one, preserve existing affordable housing. Number two, protect diverse communities. And number three, produce more affordable housing. And that is the goal of the county executive and the county government. He is actively working with the developers and nonprofits and community providers to do just that. And so with that, in terms of services to end and prevent homelessness, which is where I work further down into housing stabilization services, our programs are put together to serve to end and prevent homelessness. And we have a common vision to make accessible to all people safe, affordable housing opportunities to improve the quality of life issues that some people may be struggling with. So our mission is to make homelessness a rare, brief, and non-reoccurring event by operating from a housing first philosophy. And so our organization within the county government provides a full continuum of services, including housing stabilization, which is where I work, homeless diversion, and permanent housing, and employs evidence-based and promising practices to do all of this work. And so SEPH, Services to End and Prevent Homelessness programs, we collaborate with the public and private partners, many of which are here this evening, through the Interagency Commission on Homelessness. In terms of addressing the special needs of the population, including veterans, individuals and families, and behavioral health challenges, we work together in the Department of Health and Human Services to tackle all of these things and much more. But specifically in terms of housing stabilization services, which is where I work, we provide case management and limited financial grants to support residents at risk of homelessness. And so our services include an assessment of needs if someone has a financial hardship or is at the risk of losing housing, emergency financial assistance, and case management to help households keep their current housing, to preserve that housing, and in some cases obtain new housing. And then we also provide several other services within the county. We help to prevent utilities from being cut off. and restore any utilities that have been disconnected. And we also provide moving and storage assistance, and burial assistance grants are also available. Currently, in housing stabilization, the program that I oversee in the Silver Spring area is eviction prevention grants that are available to households that meet the guidelines that we have in the county. And so those guidelines are if you have a financial hardship, or if you are at the risk of losing housing in some form or fashion, you should get in touch with us so that we can make an assessment regarding whether or not we can assist you. What you need to have is this: you have to have at least a court summons, a judgment, something from the courthouse. A court summons is just your appointment to go to court. It doesn't mean that you've received a writ of eviction. It does not mean that you've already received a judgment. So we've sort of worked with some of our county partners and the applicants that are coming in, because we realize that we don't want people to be at the brink of catastrophe in terms of trying to get these services. So we've now implemented summons, which means you're just getting your notice, which gives you much more time to be assessed so that we can properly assist these families. And what else was I going to tell you? That's pretty much it in a I guess the big ball of wax. But on a daily basis, in terms of metrics, Liz provided great metrics and she had a great PowerPoint. I apologize, I don't have that this evening. However, what we are currently doing is we're extrapolating the data from our triage electronic registration system called QLIS at the different locations. We have 3 locations. So if you're experiencing any type of financial hardship and you're at the risk of losing housing, you can apply in one of 3 ways. And I was actually typing an email or a note in here to go ahead, and I'll push the button right now for those who are on. So let me do that so that you have this information. So if you're a county resident currently experiencing a rental hardship or an emergency, you can apply for rent relief by calling first County 311. So a lot of people think that you can only come into the office to apply. That's not true. You can apply just by calling 311. They'll connect you with services to end and prevent homelessness. Our email, I've attached that email, hhs.montgomerycountymd.gov. If you email that particular email and ask for information about rent relief grants, someone will connect you with a triage person. You will be screened, and at that point, if you have the proper documentation, you'll be connected and assigned a caseworker who will assess your case and work with you to help you resolve that issue. The last way you can apply for rent relief is by visiting one of our 3 locations. We have an office in Germantown, Rockville, and Silver Spring. I've also attached our website information if you want to go to the website and read more about our programs, or for some reason, if you want other contact information to see the host of different services that the Department of Health offers, you can go there as well. In terms of metrics, I don't have that information, but again, I told you they're right now in process of trying to extrapolate that data. But I can tell you that we've served thousands of persons since the beginning of the pandemic, not only for COVID rent relief, but also for emergency services, rental issues and other issues coming in. As I mentioned, sometimes it's moving and storage, sometimes it's burial assistance. There are a number of different emergency situations that we deal with on a day-to-day basis. We're open 5 days a week at all 3 locations. We open our kiosks, our triage windows, where you can come and register and ask questions, are open at 8:30 a.m. and someone is there every day until 5 p.m. So if you register in our triage system, before 5 o'clock, you will be seen at any one of those 3 locations. And that's it pretty much in a nutshell. But we are
Can I-
serving. Go ahead. Sir.
No, go ahead. I'm sorry.
Okay. Yeah, we've serviced thousands of people so far in the county, and we're continuing to serve and provide rental relief grants. Currently, there are a lot of questions about, COVID grants that are still available. We still have COVID rental assistance grants, emergency grants available, rent relief grants available. However, that particular funding will probably be gone before June next year, but we'll be working with the resources that we have for COVID rent relief up until June of 2024, unless that resource is already dispersed prior to that date. And so those are our programs. Are there any questions?
Can I just have some clarification
Sure.
for our viewers? To be clear, you must have a court summons?
Yes,
when
ma'am.
Okay. All right. So, and that's the only, you can't substitute that for any other documentation?
Well, give me an example of the
Like
documentation.
a note from the landlord of the building or the
No.
property manager?
So because of the sheer mass amount of persons applying for rental assistance and who are in financial dire straits, we have to have some way to validate and verify the actual rental emergency, as opposed to, just someone saying they have a rental emergency. So when an applicant comes in, if they have a summons, that means that the landlord, whether it's a private landlord or an actual management company from an apartment, they filed some paperwork with the county that there's going to be a hearing because there is the rent, there are rental arrears, rent is unpaid. And so we utilize that documentation to go ahead and start the application process for assessment to determine whether or not those applicants are eligible for a number of different grants that we have. We have multiple different grant programs, and so we assess which grant program is best for that applicant. Yes.
So first of all, thank you, Dr. Young, for your information. We know that Services Standard Professional Analysis and Health and Human Services has a whole portfolio of various services, and that from our perspective, as you know, we know that many people have a great deal of difficulty navigating that. So one of the questions I have for you is a challenge that HHS has had for a long time. How are things improving in terms of coordinating intake? So there are many pipes. You have Adult and Protective Services, you have the COVID rent relief program, you have utility assistance. When somebody comes in through 311, how is it looking in terms of connecting the various services together so that there's no wrong door?
Okay, I will attempt to answer that question as simple as I can. When someone calls into 311, the county operators are briefed every week. They're updated on any changes, programmatic changes that may be occurring, new phone numbers, offices that are moving, or anything like that. So when someone calls 311, the operator screens them, determines which office they need to be directed to, and then they connect them with that particular office. Is that a perfect mechanism? I'm sure there's a margin of error. I could not speak to that because I don't actually manage that portion of the county's continuum of care or connectivity. However, on a daily basis, we receive multiple emails from 311 that are passed on, or information from the operators that connect us with individuals who are seeking services. So I would say that it has greatly improved from, I guess, the past in terms of what you're talking about, Matt. But right now, things are running well. We're connecting with those who need these services. We're able to have our case management people call individuals once they are assigned a case manager, and they're actively working with those individuals to help resolve their financial hardship. So I would say there's great improvement, great connectivity, and I think the communication, because of forums like this with our county partners and other entities within the county, both public and private, are working together well. So
Yeah, that's the segue, I guess. I wanted to offer out, one of the values that the Renters Alliance can provide, as we understand that navigating government services and government enforcement, whatever we're working with, can be a challenge. And so, especially for people who are vulnerable themselves, who may need someone to help guide them. And so, if anybody needs help, if they feel they can't find the right service that they're looking for, or is running into an obstacle, please reach out to the Renters Alliance. We're at info@rentersalliance.org, and our staff will get back to you as soon as we possibly can, and we can assess the situation. And because of our partnerships with Health and Human Services and Department of Housing and Community Affairs, and with our nonprofit partners like Interfaith Works, we can help navigate and solve problems. We'll also give you the bad news, if you need it, about what the reality is and what you're entitled to and what you might not be entitled to. But we want to make sure that people are very much informed. And the other bad news is that a lot of this is fairly new. You might think, well, it's been around for 10 years or 15 years. The Renters Alliance started in 2010. But what we are able to do in terms of penetrating apartment communities and the public consciousness is still just scratching the surface in Montgomery County. So everybody needs to help and pitch in. Staff, do we have any questions for Dr. Young?
Well, while we're waiting for the questions, I just wanted to mention one more thing. If you're a landlord and you have a renter, someone who signed a lease with you, and they're struggling to make rent, landlords are also welcome to call the 311 number, email us, or come into one of our offices to get information to be able to better assist their tenants. We want this to work for both the landlords and the tenants, so that we can better serve this population. So that's available as well. And Matt, while we're waiting for questions, I just want to comment that we've recently and in the past worked together, and so we appreciate the efforts that you guys put forth to assist both the landlords and the tenants, but more so just to connect us to have a sort of seamless approach to resolving some of the matters that plague a lot of the renters in the county. So thank you and the Renters Alliance for all that you do.
Well, thank you very much. Seamless is aspirational. We aren't quite there yet. Staff, anything for either of our guests, but particularly right now to Dr. Young?
Yes, one of our viewers want to know, do you have a time frame? I guess a lot of the people I talk to as well don't get callbacks from the case managers within what I consider to be a reasonable amount of time. Do you have a time frame or a suggestion, or when the viewers can expect a call back from the case manager once they talk to the case manager and they have a case number?
Let me address it, and I'll end with a response.
1 day, 2 days.
So I don't want to put a time frame on it, because the situation is this: when someone comes in, we have to prioritize how severe the risk and loss of housing is. So if someone on a day-to-day basis, a weekly basis, we get persons coming in who have what we call red and white eviction notices. So those cases are prioritized when they come in because we are trying to prevent, per the county executive's mission to stop the loss of housing. We're trying to prevent those evictions. So those are the priority initially. But all cases get assigned, and we are aware of the timelines. We work in conjunction with the circuit court. So we get a weekly information that lets us know which evictions are occurring so that we can properly serve each applicant as they come in. So timeline, it depends on specifically on the severity of the crisis. If it's a red and white, you're going to get a call right away because we're trying to stop that. If you have a summons, you have quite a lot of time. There's a lot of time afforded to you to resolve the matter. So those cases will be addressed. There'll be emails sent. And I'm not going to say that we haven't heard this before, but it's an uncomfortable situation to be in when you are looking at the fact that you can't pay the rent, and certainly understand that position. But we have to also, serve those, I guess, who are at imminent risk of losing the housing. So timeline, those who are at risk, who have the evictions, they'll get calls within a day or two. Those who come in, who put in applications after that, who have judgments, those are the next level, or any other court documents that are active. They've already been to court. They've already received the judgment. They're getting emails. They're getting phone calls within a week or two after they've been assigned. Each caseworker, I don't want to give the numbers because I don't have the statistics, but each caseworker is being assigned multiple cases each week, and they're working feverishly to serve those applicants that they're assigned. And then the summons are kind of at the tail end. They're going to get a call. We try to make sure that once a case has been assigned, that within that week, everyone receives an email. And if that's not the case, certainly you can contact my office. I'm at the Silver Spring office, or you can show up there. You can call there and ask for me, and I will look into the case. On a weekly basis, we get calls from persons who have this complaint that maybe they haven't heard from someone, or that the process is slow. And I would just say, depending on the severity of the situation, if you have an eviction notice, if it changes and you didn't originally have an eviction notice, please contact us. We want to know that, because that helps us, address the issue in a expeditious manner. At the same time, if there are any other things going on with a particular application, and you want to speak to a manager, you're certainly within your rights as an applicant to do that. And I can tell you, I spend time with applicants every week to address a host of, different questions that they have. So we're trying to do the best we can. And I think we're doing a great job in terms of, meeting the needs of the applicants, the consumers, in this case, the county residents. And we're available. We're there. You can put hands on us. You can call us. You can speak with us. And now I've seen a couple of comments in the chat where people are saying that they've had difficulty with the 311, and that's something I think that's ongoing. That's something not under my supervision, but certainly we can send those concerns to the appropriate parties so that they can be addressed.
And I will say again, the Renters Alliance can also work with tenants much sooner than those who are facing a court summons. I believe we're the ones that got HHS to get to the court summons phase, but we're actually wanted them to go even sooner. So our pressure is to go early. And so until HHS goes earlier than the summons, there's always the Renters Alliance to give you a guidance and advice on what it is, what your options might be. Don't, if you can avoid it, don't wait until you're in crisis to seek assistance. If you can reach out to us and let us have an opportunity to counsel you, advise you, point you in the direction of various resources. And I know from crisis that sometimes you can get delusional and think this is really not happening, and maybe I can just wait a few more weeks or another month or so, and we will give you some good guidance and a good reality check that will help. We've only got a couple more minutes. Is there any question for either of these experts? I want to point out the differences here. Services to End and Prevent Homelessness is a county program for exactly that, services to end and prevent homelessness. Interfaith Works is helping with people who are facing homelessness and other services around those who are most vulnerable in Montgomery County. So staff, do we have any questions for either of these expert panelists? And if not, then I want to turn to both of these expert panelists and thank them for their time this evening.
Matt,
This information. Oh, no sooner do we say we're over.
Well, I have my own, if there's no other questions that I was going to sneak in, which is that, we come across a lot of people that have gotten a call back, have connected with the caseworker pretty quickly, but then there's some kind of hold up. All right, easy, no way. There's some kind of hold up on the landlord end, whether it's a ledger or a W-9 or what have you. I didn't know if maybe you had any recommendations for people that are caught up at that phase. I want to recommend, let the Renters Alliance step in at that point, but also I didn't know if you had any ideas about that. Pardon me.
So we experience this a lot. I can't say what the mindsets are of the landlord. Sometimes it's, information. Sometimes it's bad communication between the landlord and the tenant. We don't know, right? But sometimes tenants can't retrieve the rental ledgers, and so that's problematic. What I always tell the tenants, we connect them with the Renters Alliance. We recently did that with, I guess, several tenants that were having that problem to kind of get Matt and his folks at the Renters Alliance to work from that end. So to push to get the information so that we can facilitate for the applicant and help them resolve the issue. There are instances, I think, where it's difficult, right? And the thing to remember here is if a person has a payable judgment, if it's payable and you are trying to work through the process of obtaining rental assistance, we have a lot of landlords that try to refuse the checks. And under the Tenants Redemptive Rights statute under the state of Maryland, any payment, whether it comes from the individual or a government entity, has to be accepted for payment of rent if it is redeemable. And so the tenants really need to go to the Landlord Tenant Affairs website, and they need to connect with providers like the Renters Alliance to sort of self-educate themselves so that they understand their rights. And so sometimes when these ledgers aren't provided, it's because, in some instances, maybe the landlord, is just kind of fed up and they don't want the tenant there. But the tenant has rights as well as the landlord. And so educating yourselves on those rights so that you can, contact us, let us know about the problem. Our caseworkers will call, we'll work feverishly. Sometimes I make calls if there's a problem, and then we also connect with the county providers. That's the best we can do. We can't force someone to give us a ledger, but if there's a problem, we can really tackle it from multiple directions, and most often we can resolve those issues. So,
and the Renters Alliance has a lot of experience with that as well. And just to underscore something Dr. Young said, landlord cannot refuse the rent. And one of our board members, Delegate Vaughn Stewart, worked very hard to strengthen that legislation. And so if you've got money coming to prevent an eviction, and one other small point though, technicality, if you've had 3 judgments against you in a 12-month period, and the landlord has filed for David, what is it called?
No right of redemption.
Yeah, he foreclosed the right of redemption.
The
Which means-
absolute eviction if you call the sheriff's office.
That's right, where you've had 3 judgments against you and the landlord has filed this. This is rare. You'd have to have 3 court summonses and judgments against you in a 12-month period. Under that circumstance, the landlord will have the right to refuse the check and to proceed with the eviction. Otherwise, though, a tenant has the right to pay down and prevent an eviction all the way up until the sheriff arrives. And they can do so, I believe, in most any form, check or cash, and have it, but they have to be able to pay it down. So if there's any problem with that, a landlord refusing or saying that they won't take a county check or they won't take a third-party check or whatever, then please reach out to us and we will, if we can't resolve it ourselves, we know where to go. So yes.
Matt, I'd like to mention one more helpful thing. Once we've gone through the process and a tenant qualifies for rental assistance, we have to now issue the check. As a practice, we don't issue checks directly to the tenants. We issue them to the entity that they're renting from, in this case, the landlord. In some cases, it's a management company. In other cases, it's a private landlord. In the county, there is something called CVRS. That's the Central Vendors Registration System. Every business doing business with the county can register in that system. It takes about 5 minutes, and it takes 2 days for the registration to become active. And once that registration is active, if you are a landlord of a management company, we can then go on our system, allocate the funds for that particular landlord, if it's an individual, private, or a larger conglomerate entity. And that's the way we issue the checks. And so that's a problem sometimes because some landlords don't want to register within that system. So I'm just letting those listening tonight know that if you're a tenant, if you're in an apartment building, 9 times out of 10, they're already registered with the county because they're doing business with us. But if you are with a private landlord, that's probably where those issues occur more, where we have to get those individuals registered. And that time may eat up some significant time if you're facing eviction. So please be aware of that. All right.
All right. Well, thank you very much to both of you. We're the last couple of minutes. I just want to point out a couple of things that people have been monitoring. The rent stabilization bill has been passed, but it has not taken effect yet. So I want everybody to keep that in mind, that the Department of Housing and Community Affairs is still working on regulations having to do with that bill that have to go before the council and be approved. So there's no enforcement of a rent stabilization legislation in Montgomery County yet. And we are seeing, unfortunately, irresponsible landlords taking advantage of this gap by raising rents excessively. If you've seen your rent go up excessively, then I would say anything over 5%, 6%, then you are certainly free to contact the Office of Landlord and Tenant Affairs and let them know. You can do that by contacting them at olta.intake@montgomerycountymd.gov. Again, they need to be able to track how many of these excessive increases are coming in, especially those over 10% in the double digits. They are excessive, and in some cases, not all, so I don't want to guarantee anything, but in some cases, they can help you negotiate a lower rent increase. We also want to know about it too. So by all means, reach out to the Renters Alliance at info@rentersalliance.org to let us know about any excessive rent increase or any other issue that you're having with your landlord. We also want to remind everybody that one of the things that we do a lot of is organizing tenants associations. So if you're in an apartment community, whether you're having difficulties or not, I want to say, it's usually best to get to us before you're having difficulties. So to form a good tenants association in a building so that you can be a clearinghouse for information, find out what your neighbors are doing, and what issues that they're experiencing so that they're not singled out, but rather that you can act collectively to address problems or improve the quality of life in your community. So we do that, and you are more than welcome to reach out to us and let us know if that's something that you want to do in your apartment community. And of course, always we're dealing with individual tenants that have issues to guide you to resources, to advise you on your rights and responsibilities. And we have a great deal of experience dealing with property managers and landlords, good ones and bad ones. And we know how to do that. So please get in touch with us if we can be of assistance. Staff, is there anything else we'd like to raise this evening?
Yes, Tim, were you about to say something?
No.
I did want to say, I wanted to acknowledge some of the comments I've been reading about HOC and their interplay with both DHHS, Interfaith Works, and what's going on here. They're not represented tonight. But, I want to, first of all, acknowledge those comments, acknowledge the difficulties people have been expressing, and then just put out there that, we have been hearing some of these things too. They have their own limited capacity issues, their own being contacted issues, and everyone who deals with them, whether you're a voucher recipient or whether you live in one of their properties, you're entitled to understand what your agreement with HOC and HOC's agreement with your property. You're entitled to understand if they stop paying, why, and all these things. So if you have any questions about that, please reach out to us individually. We want to encourage people to pursue that understanding, because it has become a problem for some people. We've noticed, and I've been seeing that in the comments. But that was, I just wanted to throw that out. And then also, as Liz mentioned, when you're looking for a new property, it's hard enough to find places on the market in Montgomery County right now. If you're running into discrimination because you have a voucher or for another reason, please let us know. Thank you.
Indeed. Thank you, David. Yeah, one of these days we will have a session on HOC, but I don't think an hour and a half is going to do it. But we will keep working on that issue. A couple other quick reminders. If you have a complaint about maintenance in your building, that is, your appliances don't work, your mice or vermin, leaky pipes, something like that, and you're not getting response from your landlord after giving them a reasonable period of time to fix something, then you have a right to file a code complaint. Call 311, ask to speak to code, and they can send an inspector out to take a look and demand that the landlord fix the problem. And if they don't, to fine the landlord for not fixing the problem. So we urge you to do that if you have a maintenance problem. Likewise, if you're not receiving the services that you are entitled to, who's calling me now? If you're not receiving the services you're entitled to, or your rights are being violated, then you have the opportunity to call the Office of Landlord and Tenant Affairs, and you can also contact them at olta.intake at montgomerycountymd.gov. olta.intake at montgomerycountymd.gov. In addition, the Renters Alliance works with the Access to Counsel program. So if you are in need of an attorney because you're facing eviction and you are low income, we can guide you to those services. So please, again, reach out to us. We're a resource on hopefully everything having to do with renters in Montgomery County. So with that, let me turn to Liz Kruger and say thank you very much to Interfaith Works and to everything that you do. You are a tremendous resource, and thank you to your staff and everybody who works with Interfaith Works and for your partnership and attending our town hall tonight. And to Dr. Anthony Young for your service to our country as a former Marine, but also to our county at Services Stand and Prevent Homelessness. Thank you, Dr. Young.
Thank you, Matt.
Thank you to everybody. Thanks for attending. Again, contact us if you have any questions or concerns we didn't get to tonight at info@rentersalliance.org. Thank you, everybody, and good night.
Happy holidays.
Everyone.
Bye.
Happy holidays.
Happy holidays.